why don't you introduce yourself? Third time's a charm. What's your name? What's your position? What are you doing? And what's your job and stuff?
Okay, I'm Sophia. I'm currently a Gen Surge PHO at Logan Hospital in Southeast Queensland, and I'm PGY 3.
Cool. So PHO, is that like public health officer? I feel like that's like the same as like a HMO or like or no, it's a registrar, right?
You're an unaccredited reg, essentially.
Yeah. Okay.
So
Gotcha.
it stands for Principal House Officer. Yeah.
Okay. Yeah.
What
Yeah.
do you guys call it down there?
So we don't call it like a PHO. We essentially just call ourselves like an unaccredited registrar. I guess
Mm,
you're like
yeah.
before, like last year, you're a HMO, so like a hospital medical officer or like a resident. But
Mm,
then now
yeah.
just a reg, we don't call ourselves PHOs. I guess senior health officer if you're
Mm,
like a consultant, maybe, but yeah, it's only like HMOs for like residents. It's like nothing else for yeah, anyone else like that. But anyways, that's interesting. So I mean,
mm.
this is your first year as like regging, right?
Kind of, yeah. So I actually stepped up in October last year. Um, so I didn't finish my JHO year or resident year, whatever you call it down there. Um, so yeah, I got a little bit of a head start at another hospital. And then when the regs switch over, which is February for us, is that the same for you guys?
Yeah, same. I think it's like 6th of Feb that we all like change over and stuff. Yeah.
Yeah, yeah. And that's when I started my job at Logan, and I'm here for 12 months.
So you sort of stepped up a bit early. I mean,
Hmm.
just for context, so like you were an intern, then you did like your second year as like a JHO, and you
Yeah.
sort of like went into that what you are currently now as like an unaccredited registrar.
Yeah.
Cool. So I guess how have you found
Mhm.
like the transition? Like, I mean, it's a big step up. I don't know about you, but like I sort of feel like I'm out of my depth
Mm.
most of the time, and you're just making it up as you go. But it's good. It's good fun.
Um, yeah, I pretty much like sometimes I'm just faking it till I make it. And I think you just have to wing it sometimes. Not that I'm always winging it, but um, I think it's quite a big jump going from resident to unaccredited registrar. But I'm very lucky. I feel very well supported at my hospital. All the bosses are really lovely, and the trainees that we have here are really forthcoming with teaching. And it's a very like supportive environment for a junior unaccredited reg. So,
I think that's the thing. Hey, like if you're in an environment where you get to like essentially level up safely and you've got like support networks there, you've got good like senior doctors, even like other senior regs or fellows or consultants who are like supportive of you learning and leveling up. And it's actually not a bad way to do it, even though you do feel like out of your depth.
yeah. Yeah, I think so. And I think some other hospitals don't have the same experience. I have some friends who also stepped up like me, but at other hospitals, they feel really anxious and unsupported. And so it makes stepping up like way more difficult and also like not very safe for the patients. So I feel like in a supported environment, it makes it safer for everyone in general.
100%. And then just a better
Yeah.
experience. Like you're not going to get burnt out. Other people aren't going to feel like stressed. Like the patients are getting better care. All in all, like it just, if it's comes from the top and
Mm,
it goes all the way down, the system just works completely better.
mm. Yeah, I agree. How are you finding it stepping up yourself?
Yeah. I mean, absolutely chaotic. I mean, I feel like I'm, just learning so much every single day, which is really fun and like really good. But I think, yeah, it's so humbling, like that, like that's the most Yeah, that's the biggest thing I've learned is like, and I expected it going into the role anyways. I was like, oh, I'm not prepared, but you never feel prepared. I don't think you do.
Mm,
And then you just get better and better over time. So I'm surrounded by like a great group of people who are like really supportive of me. So that's fine. And yeah, you just learn and do whatever you have to do. So it's good fun. It's good fun.
yeah.
But I mean, like going back to the start, like why'd you do this whole medicine thing in the beginning? Was there like a moment or something where you're like, oh, I can't wait to be a doctor, or like you just like watch Grey's Anatomy or something, or what was it?
Um, I was always a STEM girl in high school, so I loved science and math. Um, and then I found like human bio really interesting, and so I gravitated towards that. And then my friendship group from high school are all STEM girls, and so we kind of all influenced each other, and we all did med, which was really nice. And and then throughout med school, I kind of by process of elimination like excluded different specialties and particularly gravitated towards surgery because I really liked that tactile kind of um, not instant gratification, but I felt like it was a specialty where you could really like physically make a difference. Um, and so naturally, I just picked surgery. Yeah.
That's cool. That's cool. That you know what? That's exactly what the other person I
Mm.
interviewed said. They're like, my friends like the same subjects, and I ended up just doing that because we all like did it together and we all had fun and stuff. I don't think it's a bad answer at all. Like I think that's like really good. But what is STEM? I've no idea what STEM is. Is it just like science and stuff or?
Oh,
Oh,
science and math.
Oh, okay,
Science and
sure,
math.
sure. What does it
Yeah,
stand for?
yeah.
Is it like an acronym or something or what?
I think it's like I think it's more of an American term, but it might be like science, tech, economics, and math or something like that.
Okay, science, tech, economics, and maths. All right, let's go with that. That sounds good.
I think so. I actually don't know. I haven't Googled it. I've just heard people say it, and I'm like, yeah, that's me. Yeah,
Fair,
science and
fair.
math.
STEM. All right.
Yeah.
So you did like all those STEM stuff, and then you go straight from high school to undergrad med, like a 5-year med degree, or did you do an undergrad first?
So I didn't get into med school straight out of high school. So I did like a Bachelor of Medical Laboratory Science at QUT for 2 years. And it's a 4-year degree. So I only did half of it. And then during that time, I actually sat UMAT 3 times and GAMSAT once. It was a struggle. And then I got into Bond. So I did Bond is like the 5-year undergrad degree. And then I did that. And yeah, so I spent 7 years in university.
Okay. So same as me, but like a different path. So you did 2 years of this like medical laboratory degree, which is a 4-year degree, sat the UMAT and
Mm.
sat the GAMSAT, but presumably Bond for that medical degree doesn't need UMAT. Like that's a GAMSAT thing, right?
So you don't need UMAT or GAMSAT. It was just ATAR and an interview. But I sat the GAMSAT because I had registered for it before the Bond offers came out. So I knew that I had gotten in, but I had already applied for like registered for GAMSAT. So yeah,
Got you. Got you.
that's
And
how
it
it is.
was too late
Yeah.
to pull out. How was the GAMSAT anyway?
Well, it was a unique experience because I didn't have any pressure essentially. So I felt like I did it anyways because I had paid for it, and I was like, well, I might as well just I don't know. Some people would have just not sat it altogether, but I was like, well, I studied for it, so I might as well. Um, but it was like I mean, I felt very lucky because I had no pressure whatsoever sitting it. because I knew I already got in. But it was a shitty exam nonetheless.
What are your thoughts on all these like these tests, like the UMAT, the GAMSAT? I mean, I don't really like them as term in terms of like a a selective mechanism to for people to get into medicine. I don't think it really chooses. Yeah, I just don't like it. I'd prefer people to get in based on like their academic grades in an interview rather than like this weird test that
Mm.
sort of odd things. What do you think about it?
Yeah, I think the UMAT was not an accurate representation of a person's suitability to do medicine. Um, Particularly section 3, like just patterns. I don't think that that's really a good measure. GAMSAT I think is okay because I think it's relevant if you're coming from a non-medical undergrad and they want to assess your baseline medical knowledge. That I think that's fair enough, but I don't think it has to be 6 hours though. Um, and then but I agree. I think it should be a combination of academic merit and interview. And like, as seeing medical students now from universities that didn't need interviews, they produce some interesting students, is what I'm going to say.
Yeah, because I
Yeah.
is it Uni of Queensland who I feel like were they the ones who you get in straight from your GAMSAT score, like, or is it other unis that you were thinking of?
I think UQ has, well, at the time that I applied, UQ had both. So you could do a direct entry where you're accepted into medicine straight out of high school, but you just go and you do your undergrad first. And then once provided you pass that, then you just go straight into the 4 years of MD. But you can also do like a totally different degree and then do your GAMSAT and then get into MD that way as well. So they had two pathways. Um, and I think the first pathway doesn't need an interview at the time. I think I do now. But back then, when I did it, you just needed, it was HR and UMAT
Yeah, it's a bit
for
interesting,
undergrad
hey,
at
because you
least.
could just
Yeah.
like ace this test and then just get in straight away without even having a conversation with someone in real life, which I think is like I don't know about you, but I get into an interview situation and I'm like excited to like show off you know, like your like
Mm.
personality. Like I feel like that's just me. I'd rather do that than sit an exam or, try to rearrange some shapes in order that I don't understand.
Yes. Yeah, yeah. I agree. I actually not I didn't enjoy the MMI interview that I had, but I thought it was like a really good way that I could showcase my strengths because I think like you I like to verbalize and show my personality in face to face rather than just pen to paper. So I think that's yeah, I would agree.
Yeah, I mean, it's pretty much like interview speed dating. It was pretty funny going around ringing the bell. Like, it's odd. It's an odd situation.
Did you have what uni did you go to?
So I was a Melbourne kid. So I did Uni of Melbourne
Mm,
for my undergrad in like biomedicine,
mm,
and then did the postgrad MD at Melbourne as well.
yeah. So you sat the
Yeah.
GAMSAT then?
So I sat the GAMSAT, and then did like the MMIs and stuff, and yeah, just like had to get like your grades up through undergrad and stuff.
Mm.
But yeah, went through that whole shebang. It's fun. It's interesting. I mean, it's so I like that whole undergrad thing of like you try to do a degree with no guarantee of getting into medicine, but you have full intention of doing medicine.
Mm.
I feel like that's a little bit stressful. If I could get in straight from high school, I would.
Yeah. But you know what? I think sorry, I just wanted to say going to Bond, we had a really nice mix of kids that were straight out of high school and kids that were like me, did a bit of a degree, and then post grad kids. And it's really apparent the difference that these different groups kind of like how they do academically throughout med school. And I found that those that were straight out of high school, they couldn't cope as well because they'd just finished uni and then they've just like been thrown into the deep end with med school. Whereas I was really grateful. Like initially, I felt like, oh, I'd wasted 2 years doing another degree. Not that I had a choice, but I'm actually really grateful that I went through that experience because then that was like a bit of character building and I was able to like I had the 2 years to find my feet in like a uni environment and I kind of learned like what study strategies worked for me and I had like a bit of background knowledge medically as well and I think that was really good. So I don't think that it's the worst thing to not get into med school straight out of high school.
I don't disagree with you. I think there's a lot to say for like life experience, maturity, just more knowledge, more time in the game. But I guess the main issue I have is like the lack of guarantee with it. So you
Mm,
do this whole degree for like 3 years, like that I did. And then there's people who just at the end of it had a full intention of doing medicine but are essentially left with a 3-year degree that they can't do a whole lot with in the big picture of things, which is kind of frustrating. It's kind of a little bit unfair, but I don't know. I don't know what the best situation is.
that was definitely weighing heavily on my mind, like throughout my undergrad as well. I hated my undergrad. Like it was definitely not what I wanted to do. And so I was like, if I don't get into med school, I'm screwed and I'm going to be really sad. So it was like a lot of stress. Like I feel I know how you felt. So yeah.
It's an interesting mindset. I think I only did subjects that I was going to get a good mark in. You know, like we had a lot of
Mm,
subjects which was like they were, you know, you do a bit of research before you start the year. You try to do like easy elective subjects that didn't take much time, so you could focus on getting good marks for your science subjects, and
mhm.
then your elective subjects were actually okay. But yeah, it's a game at the end of the day. You got to play the game and then get the points and then
Mm,
try and get in however you can. But so
yeah.
let's go back to this whole surge pathway. So you fell in love with surge and then riding that wave at the moment. What's your what's your game plan for the next like few years? Like what sort of direction are you thinking of heading in? Like is it more of a gen surge sort of thing or you got a different, you know, inkling for like a specialty surge?
Um, so initially I was interested in neurosurgery. And I did 10 weeks in my intern year, 10 weeks in my JHO year, and like really liked it, but thought long and hard about the lifestyle, um, and how it would be as a woman, who wants kids, wants a family, that kind of thing. And it didn't sound very promising. Not that it can't be done, but I knew I was going to have to sacrifice a lot. So then I decided to kind of redirect, and now I'm fully committed to the general surgery pathway. Um, and yeah, that's basically it. Yeah.
That's good. That's good. I mean, I feel like maybe I've definitely seen it like, you know, been made possible, but like obviously surgery for like women has like it's a completely different ball game. Like for guys, like you just don't have think about like having time off to have like kids or whatever. Like I've had a couple of
Yeah.
my old reggers who have had kids. They're like on training programs. Like it's able to be done, but I mean, it must be like a scary thing from your point of view to like want to do this whole surgery thing, but then like being like, well, when am I able to have a family? When do I even break for this? Or what does it look like?
Yep. That thought crosses my mind at least once a day. Um, I think it definitely can be done. And like, thankfully now I've had a lot of female regs, female fellows, and female consultants who are like living examples that it can be done. But it's not without sacrifice. And so I think generally, like a lot of people try to get it done. You either have kids like when you're an intern or a resident, which that ship has sailed for me. Um, or you can actually do it, I think, during your training, because from what I've heard, like RACS is a bit more uh, maternity paternity leave friendly now. I think they allow for like 6 months or something like that. I don't know, I can't remember. But I had like a reg who took 6 months off, and it obviously pushed back her training by 6 months. But I think in the grand scheme of things, if you can pop out a baby, um, and keep your position on the training program, and only have it delayed by 6 months, I think that's pretty good. Yeah.
What have the other like female regs and fellows and stuff done?
That they generally just get it done within their during their training, or like before or after, really. So, but I think most commonly it's during training, actually.
And
Yeah.
is it more like in the first year of their training? Because obviously, like, there's fellowship exams and stuff that they have to sit, which is towards the later end, um, you
Yeah.
know, towards like their when they finish like registrar sort of life. Arguably, that's a more stressful time to have a
Yeah.
kid and stuff.
Yeah. I think the ideal time, at least with the GSET program now, which is 5 years, I think the ideal time would be like in the early half. I don't know. Um, Maybe like second, third year. And then by fourth year, you'll be starting to study for your fellowship exams. So, yeah, which doesn't leave a lot of time. It's like a 2 year window. So, yeah.
Exactly. I think as well, I've heard
Yeah.
of people who get onto the program, so they apply, they get accepted, and then they defer to have a child or something before they actually start their training. I actually don't think that's actually a bad way of doing it, right? Because then as soon as you start, like you've already like had your child and you're I guess can maybe get stuff set up. I mean, obviously it's going to be chaotic no matter how you look at it or how you prepare. I mean, that's going to be
Yeah.
mayhem, but yeah, lots of ways to do it.
Yeah, I think so. I've not heard of the deferring for a year, but I think that makes a lot of sense. So if yeah, I think that's a good option too. Yeah.
It's good that you have like a lot of like female registrars or fellows or even consultants who are like have done it and they're like arguably like your go-to people to be like, "Oh, okay, this gives me like good motivation, like it can be done, it can be sorted." Like that's super cool, right?
Hmm. Yeah, it's reassuring, and it gives me hope that it's possible. Because yeah, even like a lot of people, every time I say, "Oh, I'm interested in surgery or something," they'll be like, "Oh, so you don't want kids, or you don't want a family," which is not true. Um, and I think you can have it. You can have both. But you just have to be really wise about planning and probably make more sacrifices in comparison to other specialties, maybe.
Yeah. Yeah. And so what's your next steps now in terms of like you're doing this unaccredited job? For people who actually just like real quick, for people who don't understand what this unaccredited job is, Do you want to maybe explain it in terms of just like simple, language for like a medical student or something who's watching?
So an unaccredited registrar would be a doctor who is senior to a resident who has picked a pathway that is streamlined in the specialty that they're interested in, whether it be medicine or surgery, etc. Um, and that generally means then you go through a 12-month um, timeline, rotating through surgical specialties. And your responsibilities would involve doing ward rounds, holding the on-call phone, doing admissions or consults, operating or assisting in theatre, and doing clinics as well. And so it would be the in between a resident and a trainee, but probably a responsibility level similar to a trainee. That's how I would put it. Yeah.
And was it easy to sort of get that role? I mean, there's arguably like a lot of like unaccredited gen surge positions going around, and a constant need for like more people because it's a very busy area. But did you find it hard to get that position? And if like you had any advice for like, I don't know, budding interns or residents who are interested in this like gen surge unaccredited reg role, like what would you tell them to do if they wanted to get that?
There's a few things you can do. The first thing would be try and get as many surgical rotations you can as an intern and a resident. In Queensland, every intern has to rotate through 10 weeks of surgery at a minimum. Um, and then as a resident, you can have a bit more preference with what specialties you choose. But if you were interested in surgery, you should try and get more surgical terms, both for the experience, the exposure, and also getting good connections and references and mentors. One of the reasons why I got my job at Logan is because I did 10 weeks of transplant surgery last year, and one of the bosses there um, is very well known and quite high up and has a lot of weight and say as to the jobs in Queensland. And so I obviously worked really hard and was super keen, showed my interest, and was very upfront with my interest in surgery to him. And he kind of mentored me and kind of kept me in the back of his mind for future jobs. And so the Logan job that I have now, I applied through the Queensland RMO campaign, which I'm sure there's a Victoria equivalent for that. But that's generally, there's a campaign, a statewide campaign that comes out in June. And then you kind of order your preferences for different hospitals for that job. And then if your application and your CV is competitive, then you get offered an interview. And so I got an interview, and then I got the job. But I would be lying if I said that my work experience with the big boss didn't help me, if that makes sense. So I'm going to be honest about that. Yeah.
That's interesting. So that didn't really hold much weight. Is that what you're saying in the end?
No, it did. I think it like tipped the scales essentially. So I interviewed well, and my application was competitive. But I think when it came down to, two applicants, because I knew the boss and I'd worked with him and he um, liked me, then that tipped the scales for me in the end, if that makes sense. Yeah.
Think
Yeah.
looking from the big picture, maybe some people would be like, "Oh, that's a little unfair," or whatever. But I mean, I
Mm.
think from a different point of view, it's like, I think it's like just getting familiar with people who are more senior than you, making sure that they know you, what your capabilities are, knowing that you can like do the job, that they can
Yeah.
trust you, that they can rely on you, and you just delivering on like stuff that they need to be done. Like you just like helping them out. So uh I don't know. I think that's like the exact same sort of mentality I had last year with trying to get this role is like
Yeah.
you just gotta show to them that you can do the job and you can help them out, and that's exactly like what gets you the job at the end of the day.
Mm. Yeah. It's definitely um like I had a boss back in my intern year and they said that every day at work is an interview. Like that is your interview. So you just showing up to your, 15-minute interview slot is barely what is going to get you the job. Um, it's going to work every day, being a team player, reliable, good work ethic, keen, showing up. That's the interview and that's what the bosses see. And don't think that they don't notice just because they're not on the ward. Like there were lots of wards where I built really good relationships with the other residents and the nurses were actually the ones that fed back to the bosses that I was a good resident. And so don't think that they don't know. They have ears and eyes everywhere. So that's also another tip I would give.
And I feel like you get found out like much more easily when that
Mm.
system is at play, because if you're treating one person this way and you're treating other people a completely different way, I mean, that sort of stuff just spreads around, and you don't want that bad sort of reputation or vibe, getting fed back to the wrong people, because that'll just yeah, not help you in the long run.
No, and I've definitely had I've literally worked with people who have not been such a good team player, been really difficult on the ward and been really rude to nurses, and that's cost them their jobs. So you don't want to be that person.
Yeah, it's interesting. I think, like, yeah, as you said, at the end of the day, when push comes to shove, I mean, people hire people they know, they like, they trust. I mean, they just hire people they're comfortable working with, you know? Cool. So now you're like, you're on this like path to like getting on the program. You got enough like stuff in your bank to like apply, or what's the go now? You going to do another year of unaccredited next year, or what's the plan?
Um, I feel like everyone keeps asking me this, but I don't think I'm ready at all to apply. Being a first year PHO, like I've done the primary, and so that's one hurdle out of the way. Um, and my goal this year is to churn out some research.
What's the
Oh, the GSSE.
the GSSE? Cool, cool. Yeah.
Yeah, yeah, yeah. But yeah, my goal this year was to churn out some research, to get some points in the CV, and then my goal next year is to do rural. So unfortunately, I've you know been I've been very fortunate to be living in Brisbane for 3 years. This will be my third year, and I think next year I'll have to step outside my comfort zone and move somewhere rural to get the rural points. Um, and then probably my plan will be to apply in 2026. Yeah. So in my third year of PHOing.
And so, just to clarify for people listening, like for the general surgery training program, you need to do the GSSE, which is like the general surgical sciences exam. But you don't need to do the
Yeah.
clinical exam, which is the other one. You only need to do the first part.
Yep. Yep. Thankfully, I had a friend who wants to do plastics and she just sat the clinical exam and she said it was horrible. Yeah, some of the things they get you to do, I think she had to do like a chest strain, and then uh it's all very subjective as well. It's like a really hardcore OSCE basically. But they're like so nitpicky, and it just the standard of passing differs with each examiner, so it's very subjective. Um, yeah, but I'm just glad we don't have to sit that exam. So thankfully.
Yeah, very, very tricky. But I guess you've done the GSSE. That is an exam. Do you want to just explain what it is, just for everyone listening, what that is and how you apply to do it and when you can sit it?
That was a very traumatic exam for me, at least. It's an exam that consists of three components: anatomy, physiology, and pathology, with a sprinkle of statistics and ethics. Um, and it's over the course of 2 days. So your first day is your just anatomy, and that goes for 3 hours, I think. And then the second day is anatomy and phys, and that goes for 3 hours as well. It's basically all multiple choice, and then there are some spotters in anatomy. Actually, no, I think there was some short answer. That was a long time ago, but essentially, it's a huge exam that tests knowledge from even like biomed undergrad degree to all the way through to like clinical applied knowledge, I would say. And I think most people generally take about 3 to 6 months to study for it, and there's a lot of prescribed textbooks and this infamous bank that everyone uses to study. Um, and I I sat my first sitting in June last year, and I actually failed by 0.01%. It was very, very traumatic.
What?
Yeah, I know.
Oh my
I know. It's
God.
it's it's like I was more pissed that I had to pay another 5 grand, to be honest. And that I had to sit it again. So it was a very, very character building process. It really tested me. Um, and I sat it again in October and I passed, thankfully. So for everyone who is going to sit the primary, or um, has sat it, failed, or sat it and passed, don't feel disheartened if you fail, because you can sit it again and pass. Um, and yeah, that is my journey with the primary.
That's insane. I don't know how you could pick yourself up after failing by that like smaller margin and then go back and do it the next time. I mean, that's insane.
I was broken. I truly was broken. And to know that it was a matter of like probably 2 questions. If you like really calculate it, it was probably like 2 questions. So, so I don't even know. It was too hard to calculate, but I just know that the equivalent like was something ridiculous. So, but yeah, have you sat the exam?
We'll sit it in about a month. So hopefully I don't fail by
Oh, you're sitting
0.01%.
the June sitting.
Yeah.
No,
Yeah.
I think that's just my shitty luck. Um, but all the best. I'm sure you'll pass. Yeah,
I don't know. I'll need
you'll be
all the
fine.
luck I can get. I
Oh,
Yeah, I'm not studying that well in a full-time job, but you just make the most of it.
it's rough.
I try to procrastinate as much as I can. I'm
Mm.
doing a good job of it, but this has been like an unreal chat. Uh, Thanks so much for like sharing like the story and stuff. I mean, it's been like, yeah, it's interesting to see like someone who's in a very similar position to myself in a completely different state go about it in a different way, different journey. So that is, yeah, super interesting. So thanks for coming on and sharing your story and everything like that. It's awesome.
No, yeah. Thank you for having me. Thank you for this has been an interesting experience. I've never done this before, so it's good. It's good to chat to someone who's in a similar boat to me.
100%. 100%. I don't think it gets done enough. you're always like head down and everything. But thanks very much. All right, so that's the end of that conversation. If you want to be part of something like this, you think you have an interesting story in medicine to share, maybe it's how you got in, and maybe it's that you got on a different training program or you went through some adversity, if that's something that you think you'd be interested in doing, then send me a message. The link will be in the description, how you can get in touch. If you know someone else that's probably keen to share their story, or you think that they would be a great person to share on this, then definitely link them in and we can get them on. If you want to stick around, there's plenty of other videos on here to check out and keep you informed, keep you interested, and keep you learning more about medicine. So there you go. Otherwise, we'll see you next time. Bye.